So, you're back for more of the skeleton or the skeletal system. So, previously, we were focusing on the cellular level, the tissue level, the extracellular matrix, different types of bones, kind of getting our feet wet, if you will, in terms of this particular system. We also talked about how bones come to be and how they continue to grow, how they get reabsorbed as well, resorption, as they're acting as a calcium and phosphate store, mineral store, etc. So now we're moving from that, we're moving to, again, the gross anatomy, the macroscopic scale. So we're going to be taking a tour of the different bones of the skeleton and doing a tour of the different bony markings, because as we said, what we're doing is we're laying a foundation for our next system, which is the muscular system, because the muscular system, a lot of our muscles are skeletal muscles that need to attach to the skeleton in order to move the skeleton and move us. So that's where we're going to keep our focus now, is looking at these different bones. What's the difference between left and right? What's the difference between axial and appendicular? What's this projection? What's that depression? What's that hole going through, etc. So I hope you're up to the task. We're going to be doing it as well in lab, but this way you're going to have a foundation for it. So let's take a look. Okay, so like we said before, the skeletal system is mostly going to be bone, but as an organ system, each of those bones is an organ, and it's going to be comprised of mainly that connective tissue that we know as bone, but there's also going to be cartilage associated with it, right? We're going to see all three types of cartilage associated with these bones in some way, in some place, and connective tissue like ligaments holding these bones together, helping to form joints. So we'll see that in the next chapter where we talk about these moving parts. But when we look at the skeleton overall, remember that we have two major divisions, right? We have axial skeleton along the main axis, and then appendicular skeleton for the appendages. Alright, so part one then is going to be axial skeleton. So how many bones in the body did we say? 206. So less than half of those are in the axial skeleton. About 80 of those bones are part of the axial skeleton, divides into three regions. Those being the skull, the vertebral column, and the thoracic cage itself. Okay, everything associated with that midline of the body. And we have three major functions for this axial skeleton. It forms the main axis, longitudinal axis of the body. It supports the head, neck, and the trunk. And it protects the brain, spinal cord, as well as thoracic organs. So really what we're talking about there is going to be this area that you see there that is highlighted in blue. So those are our axial bones. Appendicular ones are either going to be the bones of the appendages or those bones which attach the appendicular bones, or the bones of the appendages, to the axial. So for instance, we can see in here and in here we've got bones there, and here we have bones that are attaching these bones of the appendages to the axial skeleton. So those are also part of the appendicular skeleton. So we're going to focus on axial skeleton right now. Now, of those 80 bones, we find that a lot of them are contained within the skull. A lot of unique bones there. Irregular bones, flat bones, etc. Okay, two sets of bones of the skull. We have the cranial bones, which is going to be encircling the brain, forming a cranial cavity, and also provides different places of attachment for muscles of the head and neck. So we have the cranium, and then we have the facial bones. So the facial bones are going to be more unique still, really weird shapes looking like bats or walnuts or jigsaw puzzle pieces. And for here, we have the framework of the face. We also have cavities for the special sense organs, like for smell, for sight, for hearing, etc. Contains openings for the passage of food and air. Has the teeth in it. Special joints of the teeth that we'll talk about later called gomphoses, kind of peg and socket joints. And then, of course, as a place for anchoring the muscles. So when we look at these skull bones, like we said, a lot of them are going to be flat, and those flat bones come together and form joints that are called sutures. And they kind of interdigitate, if you will, kind of like the epidermis with the dermis, and that helps to form a lock between them. Now, these sutures tend to be immovable, as you can imagine, but depends on what you're talking about in terms of the study of them. So Western medicine considers them to be immovable, but in fact, there's branches of Eastern medicine called craniosacral therapy, where they would suggest that you can produce subtle movements of these bones that can enhance or impede cerebrospinal fluid flow. So, in any case, you can imagine if there is some movement there, not a lot, right? So if we look at those joints, right, sutures holding these together. In fact, some of these sutures are so small it's hard to really tell where one bone starts and one bone stops. Particularly if you look at, something like this. This is a superior view into the calvarium, into the cranial cavity. We can see where the brain sits, and it's really hard to differentiate where the different bones of the cranium and even the face start and stop. So here's a lateral view. We can see where the brain is housed within the cranium there. We can see some of the cranial fossae. Remember a fossa? What's a fossa going to be? That's right, it's that dad on Lion King. No, so the fossa are going to be shallow depressions. So you can see shallow depression, shallow depression, shallow depression over there. So we're not learning those cranial fossae, but you can see how they help to create a shape, a supportive shape for the brain. Now here, we're doing a different type of cut. So this is a frontal section, also called a coronal section, down through the skull, and we can see some of the cavities, right? So we can see the cranial cavity, we can see the orbital cavities, where the eyes go, you can see some of the sinuses in here, these air-filled spaces of some of the bones, you can see some of the nasal cavity, these are maxillary sinuses, where, sometimes you can get that sinus pain down there, and then of course the oral cavity down below. So lots of spaces here in order to house other organs. Okay, so when we're talking about the cranium, we're going to find broad flat bones here. So frontal bone, parietal bone, occipital bone, temporal bone, sphenoid, and ethmoid bones. Now here's the thing. Notice some of those are plural and some are singular. In development, these bones, like the frontal bone, start out as two separate plates, but they do a complete fusion on the anterior side. So that makes one frontal bone that we see up here. Yet two parietal bones high on the sides, one occipital bone in the posterior, two temporal bones, a left and a right, and then a sphenoid and ethmoid bone that are kind of buried here and kind of straddle the border between cranium and facial. Okay, so what I'm going to do is, like usual, I'm going to focus mainly on the images, and we'll look at some of the different bony markings on these particular bones. So we're focusing on frontal bone, so we can see it here, right? This yellow one that we see here. So that's the frontal bone. And you can see it's a broad flat bone. We can see that it helps to form the eyebrow ridges. So this is called the orbital, or optical, if you will, orbital cavity. And so what we find here is that this eyebrow ridge right here is called the supra, like superior, supraorbital margin. There's also even a supraorbital foramen. Now what's a foramen? It's a hole. So remember, in order to innervate the skin and the face and the muscles up here, we've got to be able to have blood vessels and nerves get through. So that's where we see them coming through. So we have supraorbital margins, supraorbital foramens there. There's actually a frontal sinus contained within here. We'll see that later. So a space that's in there as well. Other things that we see, now this is the superior view, all this color-coded. Notice that with the figures, color-coded the same. So frontal bone was yellow before, and we see it yellow here again. And you can see that bone, right? Compact bone, and that diplo or spongy bone in the center. All right. Other things that we see here, parietal bones. So parietal bones are high and on the side. So that's the left parietal bone. This is the right parietal bone. And you can see, now we're starting to talk about bones. These bones need to be held together by sutures. Sutures have particular names. So this one here between the parietal bones and the occipital bone, seen in gray, is called the lambdoidal suture. Lambdoidal suture. Don't forget that second D there, or lambdoid suture. This one here has a name that makes a little bit more sense. It's called the sagittal suture, right? Sagittal cuts are like this. So right along the mid-sagittal plane, we've got the sagittal suture connecting those two parietal bones. When we look on the lateral side, we can also see a coronal suture between the parietal and the frontal bones, and over here, a squamous suture between the temporal bones and the parietal bones. Okay? So, not too much in terms of what you have to know about a parietal bone, different sutures associated with it, but not really a lot sticking off of it, etc. Holes going through it, things like that. Here we see on the inside how it contributes to the calvarium, attaches to the frontal bone, etc. Now don't be confused. See, there is a definite line here between the parietal bone, which is over here, and this centrally located bone, which is the sphenoid bone. Colors are a little too close there. Looking inferiorly as well, now we see occipital bones shown in gray. We see our temporal bones in kind of a beige color. Definitely some unique shape to those. And then again, this kind of purple color is going to be our sphenoid bone right through here. We can see just a little window of our parietal bones up in here. But as we look at the inferior surface of the brain, we can see lots of different ridges and holes, etc. So these are going to be important. Now, when we're learning the bones, we learn the name of the bone, and then we learn any bony markings associated with it. Parietal bones were easy. Frontal bones had a couple things. But as we get to some of these other bones, like you see the occipital bones and the temporal bones and the sphenoid bone, these bones have more holes and bumps and ridges, etc. So we've got to pay attention to those. Now, we're not really going to ask you a lot of these particular bony markings in lecture. That's one of the main things we focus on in lab. And if you haven't noticed already, we tend to do a bit more anatomy in lab and then a bit more physiology in lecture. But we do like to kind of go through some of these things in lecture so you have a good overlap and introduction as you go into lab and see it demonstrated there. Okay, so sphenoid bone. We've seen the sphenoid bone is kind of odd shaped. In a way, it kind of looks like a bat, right? So you're seeing a superior view. You're looking down on it here. You're seeing a posterior view. If you were to view it from the anterior, let's see if we can get a shot of it again. You can't really see a lot of it. It's buried in here, but we can see some of the wings of it in here and in here, and you can see them showing up a little bit on the lateral sides. We can see it here, again, helping to form the floor of the cranium. Lots of different holes going through it. So again, it looks kind of like a bat, a little bit more so from the anterior side. Unfortunately, they don't show it that way, but you can see the bat reference, right? And so, you can see a body of the bat through here. You can see the legs of the bat down here. You can see the wings of the bat out here. And you can see the ears of the bat for its head along here and here. And even from the anterior side, there are actually like eyes of the bat. There are holes that go through there. So the sphenoid bone has a number of different structures that you actually need to know. The wings of the bat are called the greater wings. The ears of the bat, like we see here, are called the lesser wings. Then these are called the pterygoid processes. The P is silent, so it's like pterodactyl, the pterygoid processes that we see extending down there. This helps to form the nasal cavity like we see underneath there. There's also, right here in the center, in the body of the sphenoid, this little depression here. That's called the sella turcica. What that means is Turkish saddle. So, you know, for you horse enthusiasts, you equine people, a Turkish saddle, if you were to picture a saddle, right? So you have a pommel that comes up here and then it comes down like this. And in a Turkish saddle, it actually is high on the back side as well, like that. So that's a bit like this area right here that we're seeing from the top. So this is called the sella turcica. That's the Turkish saddle. What sits right here is a very important gland, the master gland of the body that hangs off the inferior surface of the brain. It's called the pituitary gland. So it cups that pituitary gland right there. Some other things we can see with the sphenoid bone, again, we can see some holes. So we have some little ear holes here that basically go through underneath the ears of the bat, underneath those lesser wings. These are the optic canals because the eyes are right here, and so the optic nerves are passing through that sphenoid bone. They're crossing, and then they're running back to relay signals back to the brain. So those are called the optic canals right there. There's some additional holes, if you will, that you can see down below. This one here is called the foramen ovale because it's oval shape. The one that's posterior and lateral to it here is called the foramen spinosum. And then anterior to it is called the foramen rotundum. So rotundum, ovale, and spinosum. Ross. Like Ross from Friends, you know, when we talked about genes and stuff like that and making recipes. In any case, those are some of the holes. Again, passages of blood vessels and nerves. All right, so we saw sphenoid bone as well, ethmoid bone. So the ethmoid bone is located right here. You can see that shadow? It's deep in there. It contributes to the nasal cavity, contributes to the orbital cavities, the eye sockets right here, contributes even a little bit to the cranial cavity up here. Okay? Kind of looks like a walnut, but it does have extensions coming off of it. One most notable extension is right here, called the crista galli. And if we quickly go back to the superior surface of the brain, this here is the ethmoid bone right there. And that crista galli, that little point, is right here. It sticks up, and it serves as an anchoring point for the brain. So there is some connective tissue that comes down between the two cerebral hemispheres, and it attaches to that one point, just like processes on bones are supposed to do. So it comes down and attaches to that crista galli, anchors the brain, or helps to, in the cranium. Some of the other things we can see about the ethmoid bone is that it has some holes in it, like we see here. So these are called cribriform foramina. This whole flat surface here is called the cribriform plate. So it's flat. The crista galli comes up out of it like that. Now, in addition to the cribriform plate, which helps to form the bottom of the cranium, we have another plate that extends down here in towards the nasal cavity, which is called the perpendicular plate, because this one goes up and down, and these ones go across. The cribriform plate goes across like that. In addition to that, we have some little extensions coming off of it called the middle nasal conchae. This is a k sound. So an individual one's a concha, conchae if we're talking about multiple ones. So these extend down into the nasal cavity as well. In addition, there are ethmoid sinuses. So there are spaces within the bone called ethmoidal sinuses that we'll see if you have the cut that's just right. So again, we can see some little windows of the ethmoid bone contributing to the ocular cavity here and contributing to the nasal cavity. Perpendicular plate, and here our middle nasal conchae. Now you see that there's an inferior nasal concha. That's a separate bone. See how it has a different color? Separate bone. Okay? Oh, one other thing to notice as we're looking there, notice that the superior part of the nasal septum inside of the nasal cavity is that perpendicular plate of the ethmoid bone. The inferior part down here is a separate bone that's called the vomer. All right, other things that we see. Sutural bones. Well, we said that on average we have 206 bones in the body, but this is where some of those additional bones come in. So often along this lambdoidal suture you may have additional bones that have formed, that like little puzzle pieces that are called sutural bones. They form within a suture. So that's not uncommon. Sometimes you'll get them associated with different synovial joints, other different types of joints as well. And so that's why not everybody has 206 bones. It may be more. So here's our occipital bone as well. Don't forget about that one. So when we look at the occipital bone, we see an external occipital protuberance. That's a bump that you can feel way in the back right there, likely. You can also see down here a couple of condyles, these large projections. These condyles stick down like that, and they articulate with the first cervical or neck vertebra, so that we form the joint between the skull and the vertebral column. You'll also see, let's get that inferior view again, that there's a massive hole in that occipital bone. So this is so big, we call this one the foramen, because it's a hole, foramen magnum. And what goes through there? Spinal cord, right? Spinal cord has to connect to the brain. You can also see some additional holes. This one is a rather large one. This one's called the jugular foramen. It's formed at the junction of temporal bones and our occipital bones. There's also a carotid canal. Now you may, that's anterior to the jugular foramen, you may recognize those terms. So what goes through the jugular foramen but the jugular vein, draining blood from the brain, and then what goes through the carotid canal but the carotid or internal carotid artery that's supplying the brain with blood. A few other things that we can see in the inferior view right here. We can see, in addition, some of our bones that are on the anterior side. So these are going to be part of the facial bones that we see up there. Okay, so facial bones. 14 bones, 12 of which are paired. We have one mandible, one jaw. So when you talk about lower jaw, upper jaw, etc., not so much. Mandible, maxilla. Okay, so you have to use the specific anatomical terms. So maxillary bones, one mandible, zygomatic bones, or your cheekbones, nasal bone, lacrimal bone, right, in here, kind of where you cry. Palatine bones help to form the hard palate, the roof of the mouth. Vomer, like we saw, dividing the nasal cavity, and the inferior nasal conchae extending in. So here's our mandible, and we can see mandible is a very unique shaped bone, right? And when we look at it, lots of different projections and holes, etc. We said this is the mental area. You stroke it when you're thinking, and there are two mental foramen right there. So those allow nerves to come and innervate all of this in here. You can also see, right? So this is the body of the mandible. Sometimes the main part of a bone we'll call the body. Then we see how it gets an angle like that. So they call that mandibular angle. And then see how it splits into a Y. So this part right here is called the coronoid process. Remember, a process is something that sticks out. This posterior part here, which is a bit more rounded, is called the condylar process or the mandibular condyle. And you can see that it forms a joint with the mandibular fossa of the temporal bone. So it forms that hinge joint, right? TMJ, temporomandibular joint. So when you say you have TMJ, guess what? Everybody has TMJ, right? You have a TMJ syndrome because you get tightness there, or lockjaw or something like that, because you're gritting your teeth at night studying for Bio 201. But it's just the name of the joint, a synovial joint, a hinge joint like we see there. So most of the movement's going to be like this. You can get some lateral movement. We'll talk about that later on. But the fossa is the depression. The condyle is what goes into it, like that. All right. So the mandibular fossa is on the temporal bone. Meanwhile, the mandibular condyle is on the mandible itself. Okay. There's also the mandibular notch in between those two structures. And we'll find, see these round-like structures here that go up and down and help to form these little openings? These are called alveolar processes, or the alveolar margin, for where the teeth articulate. You also find that there's a mandibular foramen, and what's going to come in here? Nerves. In fact, very critical as you go, if you're going into dental hygiene or dentistry, nerves associated with the mouth are going to be critical. And so if you are doing a nerve block to block pain, etc., that's going to be an important one. One other thing that we see here with the mandible, the ramus of the mandible. So this area, which is kind of straight through here, we call this the ramus. We'll see that term come up again as well. Okay, then we go to the maxillae, right? Two maxillae, one here, and then one on the other side as well. So you can see eye socket is going to be up here. Here is the mandible or maxilla, where we have the teeth coming in. Alveolar processes again, or alveolar margin. We can also see an infraorbital foramen, right? Because it's underneath the eye, right there. And this is going to contribute also to the eye socket. Okay? Okay. Other things that we can see. This is an interior shot. So this is a parasagittal shot. And it gives us an idea into some of these bones. We can see into the frontal sinus. We can cut into the frontal bone. We can see into the sphenoidal sinus. Here's the sella turcica, that saddle. But that main core of the bat's body, that body of the sphenoid, contains a sinus as well. So it's called the sphenoidal sinus. We can see our vomer there. We can see here the maxilla and how it helps to form the roof of the mouth. Additional shots of the nasal septum, the bony dividing line between the two sides of the nasal cavity. Now here's an interesting one, actually, the hyoid bone. Now we've been focusing up here, but look at where this one's located. So this one's located here. So it's not a bone of the skull, and in fact, this is the only bone in the body that does not directly articulate or form a joint with another bone. It's actually suspended there by different tendons and connective tissue for muscles of the tongue coming down to it and muscles of the neck coming up to it. So it's up in here. And it's a bone, if you watch like SVU and stuff like that, it's a bone that if somebody has been murdered and they think that they were choked, they'll look for it, and often that hyoid bone will be broken. So you can see the hyoid bone sitting right in there, and you'll see it in lab as well. Okay, other things that we see. Now, a lot of these bones come together and they'll contribute to form different cavities like we've seen. So for instance, we have the orbits, not just gum, right? This is for the eye as well as the lacrimal glands, which secrete the tears. Also, it allows attachment of some of the extrinsic eye muscles that allow us to move the eyes all over the place. And these are all bones that contribute to the orbit or the eye socket. Frontal, sphenoid, zygomatic, maxilla, palatine, lacrimal, ethmoid. So, another mnemonic, please feed my zebra small leaves and eggplant. So that gives you the first letter of all 7 of your different bones that contribute to the orbit, like we see here. Frontal, sphenoidal. This one over here, what did we say this one was? Zygomatic bone. This is the cheekbone, right? So it contributes as well. Maxilla, we can see the lacrimal bone right here. We can see the ethmoid bone as well along the medial wall in here, okay? So one of the things that we look at when we see here, not only are we talking about the eye socket that we see here, but we're also, some of these bones contribute to the nasal cavity too, right? Here's the nasal bone. And we said that the zygomatic bone contributes to the cheek. Now it's right here, but it's going to connect along here to the temporal bone. So the temporal bone here, and the temporal bone has what's called a zygomatic process coming up to meet and form a joint with the zygomatic bone. So you see right here, that's where that joint exists. All right, so also we've been mentioning different sinuses. Like we said, these are totally contained air-filled spaces that are inside of certain bones, like we see listed here, frontal, sphenoidal, ethmoidal, and maxillary. Sometimes you'll also have them associated with the ethmoid bone back here. And they work to warm, humidify the air, lighten the skull, and you know if you've had a sinus infection, they also can change the tone of your voice. So this diagram here, and this one here, shows some of those different sinuses. Again, sphenoidal, more posterior, ethmoidal sinuses, small ones through here, frontal, maxillary, and sometimes you get what are called mastoidal ones here, back behind the ear. Okay, one thing that I wanted to highlight, you know, we mentioned the temporal bone a number of times, but we didn't really look at a lot of the details of it. So let's take a look at the lateral view of the skull that we see here. So this is the temporal bone here. You can see it's kind of interesting shape, so it makes articulations with a lot of different bones. And here is the external acoustic meatus. Ear canal goes right through there, right? You can see there's a massive projection right here, which is the mastoid process, this bump behind your ear right here. And then there's a spiky one right here that's called the styloid process. So like stiletto heels or a stylus is like a pen. So styloid process looks like that. Muscle attached there as well. Muscle attaches here. And then here's that bony projection I was talking about, right? This is the zygomatic process of the temporal bone going anteriorly to form a junction with the zygomatic bone that we see there. Okay. So let's continue then our process, if you will, of going through the skeleton. We're on axial skeleton. Our next step is going to be going through those other bones that contribute to the main axis of the body. But we'll stop there. That was a good first start looking at the skull.